Today class, after a long journey of 1 year or even 2 years study, we have gone through the basic theory, the diagnostics, the general introduction of the Chinese materia medica, and the general introduction to the prescriptions. So we have learned the principles, how to structure the formula. Eventually, we are going to study the therapeutics of acupuncture and Moxibustion. This subject is slightly different from the previous ones. The previous ones, most of them are considered as the foundation subjects. And then the acupuncture and Moxibustion is actually the bridge from the basic theory, from the foundation to the clinical practice. And now in this subject, we are going to focus on the clinical perspective. We're going to study the diseases, what are the manifestations of the diseases, what are the causes of these diseases, and how to treat them, what's the management, and during the treatments, what should we be care of. So all this information we're going to study in the therapeutics. Similar to the other subjects, at the beginning of the introduction, we always talk about the development of this module. Acupuncture, or even the therapeutics specifically. We knew that acupuncture had been practiced for long, as you can see from the history, and we always start from the classic 黄帝内经. The second volume of 黄帝内经, 灵书, it describes all those needling techniques of the meridian, the diseases of each meridian. These are the foundation knowledge that we are using in acupuncture. The basic theory that's also in 黄帝内经, in the first volume, which is the 素问, we study the 脏腑 theory, the location, the geography, the climate changes, how the human and the nature are linked. This knowledge is going to be integrated into therapeutics as well. And later on, acupuncture was introduced in the other classic, 伤寒杂病论. Although, as we mentioned previously, 伤寒杂病论 is not a monograph that focuses on acupuncture. It is more focused on the herbal medicine. However, we also introduce the treatment of acupuncture. And in some treatments, the author even suggests to have acupuncture first and then followed by the herbal medicine. There's one example that the patient suffers from headache and superficial 太阳 syndrome. The author, Dr. Zhang Zhongjing, proposed the treatment to needle the 风池, 风府. So 风池, if I'm not wrong, is GB20. 风府, just the same level in the dual meridian. So he proposed to needle the 风池 and 风府first, and then followed by the treatment from the herbal medicine, 桂枝汤. If you still remember, in the formula, we have introduced the 桂枝汤. So as you can see from the clause, Dr. Zhang actually proposed the combination of the treatment combination of herbal medicine and acupuncture. Also in this classic, Dr. Zhang emphasized that the Moxibustion, although we use a very mild heat, very mild fire, however, this heat can benefit the heat of the body significantly. So it described that we need to be careful when using Moxibustion. You need to identify which situation we should use the Moxibustion, which situation we should not use Moxibustion. For example, a patient suffers from excess heat, nose bleeding, a red tongue, constipation, very bad mouth smells. All these heat symptoms. If a patient presents with the heat symptoms, or rather say the heat syndrome, in this situation, we should not use Moxibustion. So this is the principles of the acupuncture and Moxibustion. And later on, in 针灸甲乙经, another doctor, Huang Pumi, he compiled from the 针灸甲乙经, he compiled the knowledge from the previous practitioners as well as the 黄帝内经. Those contents, he reorganized the contents into different categories. After he restructured the contents, acupuncture became an independent modality in Chinese medicine. 针灸甲乙经 symbolize that acupuncture and Moxibustion has been developed into an independent modality in Chinese medicine. The reason is because although we can see the contents from the classic of 黄帝内经, the second volume, there are 81 articles on acupuncture and Moxibustion, including the theory and the needling techniques. However, these articles were not organized, and as well as the contents were not organized into specific order. After Dr. Huang Fumi's after Dr. Huang Fumi compiled this book, he reorganized the contents from the general introduction to specific discussion. This is very similar to our textbook. When we start to learn a new subject, or even very similar to our lectures, at the beginning we always start from the general introduction, then we focus on specific topic, specific discussions. After 针灸甲乙经 was compiled, this book was introduced to Japan, and the Japanese used this book as the textbook for acupuncture and Moxibustion education. Later on, in Tang Dynasty, Dr. Sun Simiao, we have mentioned quite a few times for Dr. Sun Simiao. So if you still remember in the history, we said Dr. Sun Simiao lived over 100 years old, and then he got several contributions in Chinese medicine and acupuncture. One of the contributions is the 阿是 points, right? The 阿是 points, we said the translation, actually is the direct translation, because 阿是 points is the points where the patient feels sensitive. Where when you palpate the patient will feel pain, so the patient will say, ah, yes. So 阿是 is that's the points, yes. So even in Chinese, we use 阿是 points. However, the 阿是 points is not the main points that we're going to use in acupuncture treatments. Although it is very important, but we cannot use 阿是 points as the dominant points in your prescriptions. Otherwise, acupuncture and Moxibustion is too simple. You don't have to use 3 years or 4 years to study the knowledge. The reason why is we cannot use the 阿是 points as the dominant points in the prescription. In most situations, I can't say we cannot use 100%, but in most situations, we have to use the other points, and then you can add on the 阿是 points. So the 阿是 points can benefit your prescription. The reason is because the efficacy, the clinical effects, will not as good as the other points on the meridian according to your differentiation. Dr. Sun Simiao also compiled the book, and he actually draw an image on meridian and acupoints. These images were lines with colored line. So this is also one of the interventions in Chinese medicine, the first colorful image on acupuncture models. And later on, Wang Weiyi in Song Dynasty, Dr. Wang Weiyi, he manufactured an acupuncture model, a human-sized acupuncture model. These models have different holes of the acupuncture points. It's empty inside. This is a bronze acupuncture model. It's empty inside, so we can feel water or other liquid inside. There were two models. One is for the education, for the examination. During the examination, the model, they're going to use the wax to seal the model, so you cannot see the holes of the model. And then during the test, the students need to insert the needle to specific points. If you insert correctly, the needle can go through the holes directly, and then the water can come out. If you insert in the wrong position, the needle will hit the bronze, so the needle won't be able to go in. So this is the first acupuncture model that has been applied in acupuncture teaching and training. And later on, as the time developed, many practitioners developed into different schools. They have different thoughts on the diseases. These different thoughts become different schools in Chinese medicine. There are other milestones in the history of acupuncture and Muscibustion. There are such as the Zhengzhou Dacheng, the books. If you don't, if the pronunciation, the title of the book, you can't recall any information, you may just go through the history of Chinese medicine. The study of these subjects, the therapeutics of acupuncture and Muscibustion, because this is a clinical subject, the study also will be slightly different. Previously, when we studied the basic theory, the diagnostics, I emphasized that you have to read the textbook, you have to watch the videos, you have to read the notes, try to memorize the notes. For the therapeutics, you're going to do still the same. You're going to study the notes. You're going to study from the textbooks. However, you are suggested reading other references. Other references is not the references from the articles. So that's we have mentioned previously. In Chinese medicine and acupuncture study, when you read reference, don't find from the articles, find from the famous books, find from the old text, classics, find from a second opinion from other practitioners. That's also the reason why in your learning guides, we introduce two textbooks. One is Cheng Shenglong, the Chinese acupuncture and Muscibustion. The other one is Shi Xuemin, acupuncture and Muscibustion. These two books you can use as references. Cheng Shenglong, if I wasn't wrong, he passed away a few years ago, almost 100 years old. He was one of the most famous acupuncture practitioners in China. You can use his books, you can use his experience as a reference. Shi Xuemin, the other textbook, Acupuncture and Muscibustion. Shi Xuemin, he's very famous in China now. He's one of the best acupuncture practitioners in China. Even in Chinese version of the textbook, Acupuncture and Muscibustion, we also study from Shi Xuemin. The differences between Cheng Shenglong and Shi Xuemin. Cheng Shenglong is like one generation older than Shi Xuemin. So if if Chen Shenglong was still alive, he will be over 100 years old. And now Shi Xuemin is about 80 years old. So the one generation difference, we can see the difference from the very traditional Chinese medicine, the very traditional acupuncture and Muscibustion practice, and then move on the modern acupuncture and Muscibustion. What's the difference between the traditional acupuncture and the modern acupuncture? There's a slight difference. The traditional acupuncture and Muscibustion more focus on the treatments with the manipulation, the traditional way to see the changes of the patient. However, the modern acupuncture and Muscibustion, such as the introduction from Shi Xuemin, it not only focus on the treatment of individual diseases, it also focus on the experiments of acupuncture and Muscibustion. In our program, we didn't include the experimental acupuncture and Muscibustion. This is a very important subject in acupuncture and Muscibustion research. As we study as a bachelor degree or even postgraduate, your aim will be on the further study or further research in this field. What's your contribution to the field of studying? So you need to study some experiments, experimental skills, which can help to prove acupuncture is working. Acupuncture is working, we knew from the clinical examples, we knew acupuncture is working. But how does it work? Why does it work? What has changed before and after you put the needles in? You need to find proofs. So that's something Dr. Shi Xuemin, his team focus on, such as when we say the blood circulation. For all these years, we talk about the qi circulation, the blood circulation. We said that the definition from Chinese medicine, the blood is much broader than the blood, the physical blood. But no matter how broad the Chinese medicine term is, it includes the physical blood. So when we said to improve the blood circulation, we need to find proof that you can actually enhance the physical blood circulation to promote the circulation. How do you know? So later when we introduce the points, I can't remember the numbers. I will give you the names. So when we introduce, I will give you the numbers. 风池 GB20, 腕骨 风府. So these points at the bottom of your skull, when you need those in, it can promote the circulation. How do you know the circulation can be promoted? Nowadays, we can use the ultrasound. Ultrasound, the colorful ultrasound, you can see the blood flow. If the blood flow is facing the sensor, it becomes the red color. If the blood flow is away from the sensor, it becomes the blue color. And from the color, we can see after you put the needle in, you can see the blood flow actually increased. So that's how to enhance the blood circulation. Once we can enhance the blood circulation, then we can explain why these points can be used for treating headache, dizziness, blurred vision. So these are the evidence for modern science. For all these years, I always emphasize the history, the traditional way of thinking. When we study the traditional, we should not against the modern technique. We need to embrace all modern techniques to develop the acupuncture and Muscibustion. if we can use the modern technique, if we can apply modern technique into our practice, why we need to be against with those? This we can learn from the Western medicine, the conventional medicine. For example, the oxygen is not in the medical science, but once the oxygen was invented or people realized, then the Western medicine used them to help the human health. Or X-ray. X-ray is not actually, it is not used in the medical science as well. However, once it was invented, the Western medicine will employ the X-ray in their practice. Similarly, in Chinese medicine and acupuncture, we need to be very open to new stuff. We need to keep our tradition. We need to keep our traditional way of thinking. However, in our treatment, in our practice, we need to open to other treatment, other analysis, other tests, and other examinations. This is the only way to improve the modality, the only way to improve the field of acupuncture and musculature, even Chinese medicine. Also, the only way to safeguard your practice, to have a safe practice. For example, if a patient suffers from chest pain, and then after you study the therapeutics, you will see that we will introduce how you can use acupuncture to relieve the chest pain. And then the patient may be relieved after 10 or 20 minutes. If you don't know the chest pain, what's the cause of the chest pain? Or what are the causes of the chest pain? Once the pain relief, then you tell the patient, okay, you are recovered. You can leave. You don't have to do anything. After 1 week, the family will come back to you. The patient passed away. Because for the chest pain, the patient may have a mild situation. The patient also may have acute or severe situations, such as the acute mild infarction. These two heart attacks are very different. You need to identify clearly which situation we can help, which situation we cannot help, or we can help at certain stage. The patient needs to have a further treatment or need to have a further examinations. For these aspects, you need to have a very clear mind. You need to have a very clear understanding. So when you study the therapeutics, you need to study the textbooks. You are also recommended to study the internal medicine from the conventional medicine. So use those as references to broaden your mind how the modern science understand the heart attack, how Chinese medicine understand the heart attack. When we study the therapeutics, you will see most of the disease name are actually kind of symptoms. So sometimes you will misunderstood that do we treat symptoms only? There's also one student asked me previously, do we treat symptoms? We do treat symptoms. We do focus on the symptoms. However, we focus more on the pathogenesis. We focus more on the causes behind these symptoms, although we use the symptoms as an example, such as we said dizziness, headache, fatigue, but our treatment is actually not focused on the headache, the fatigue. We focus on the cause. What cause results in headache? Which cause can result in fatigue? That's why with the same headache, we may have very different treatments. With same fatigue, we may have different treatments. One patient suffers from headache, the other patient suffers from fatigue. We may employ the same treatments on them. That's because our treatments, we focus on the pathogenesis. But sometimes the pathogenesis and the symptoms are linked, very close linked to each other. For example, the symptom of spontaneous sweating, that's qi deficiency. Reluctance to talk, that's qi deficiency. So when I say the patient fatigue, spontaneous sweating, then I will say you can tonify the qi, you can use stomach 36, you can use zone 6. So these, when we use the symptoms or we use the pathogenesis, no matter which way we use, our focus is always the pathogenesis. And sometimes we focus on the symptoms. So don't misunderstood that acupuncture, we focus on the symptoms. We need to focus on the pathogenesis. We need to focus on the causes behind the symptoms. This is the only way to prevent it happen again, to maintain the health for long term. In this video, we give you a very brief introduction on the background of the therapeutics, and also we have mentioned again for a few medical books. And for the study, same as the previous contents, you need to memorize, you need to read some references. The references you are suggested to read some other books, especially the textbooks in conventional medicine, especially the internal medicine. From the next video, we are going to discuss the functions of the treatments, the functions of the acupuncture and Muscibustion treatments, as well as some principles during the treatments. Thank you for your attention.